Hello, I am Dr. Khalilah Jefferson, DNP. Today I want to discuss when outcomes aren't what we hoped, growing through the hardest moments in healthcare. What defines us as healthcare providers isn't only our successes, it is how we respond to the moments when outcomes are not what we hoped for. I want to start with a moment many nurse practitioners know well. You walk out of a patient's room. The outcome was not what you hoped for. Maybe a diagnosis came too late. Maybe the treatment did not work. Maybe despite doing everything right, the patient still declined. Or sometimes it's even harder. You performed a procedure you're trained and credentialed to do, one that's supported by guidelines but still debated in some circles. And a known complication occurs. Suddenly the room feels different. There are questions, second guesses, maybe even criticism from colleagues or others outside the room. And in that moment, something heavy settles in your chest. You replay every decision. Did I miss something? Should I have done something differently? Did I make the wrong call? In healthcare, we are trained to pursue the best outcomes possible, but we are rarely trained for something equally inevitable: undesirable outcomes. Because the truth is this: medicine is powerful, but it is not perfect. Every procedure, every medication, every clinical decision carries risk, even when we follow the evidence, even when we follow protocol, even when we do everything right. For nurse practitioners, especially, we practice at the intersection of expertise, autonomy, and trust. So when a complication occurs, particularly from a procedure, some still debate, it can feel like the spotlight is suddenly on you, not just clinically, personally. How do we regroup after those moments and continue to grow as clinicians? But here is the important question. I believe it starts with three steps. First, pause before judgment. Healthcare providers are often our own harshest critics, but reflection and self blame are not the same thing. Reflection asks, what can I learn from this case? Self blame says, I should not be doing this. Growth happens in reflection, not in shame. Second, return to the evidence and the process. When complications happen, especially with procedures that spark debate, it's easy for conversations to become emotional or political. But grounding yourself in what matters most is powerful. Did you follow the training? Did you follow the guidelines? Did you act in the patient's best interest? Complications do not equal incompetence. They are an acknowledged part of medical risk. And third, lean into professional community, not away from it. The instinct after criticism can be to withdraw, but growth in healthcare has always been collaborative. Discuss the case, seek mentorship, engage in honest review, not to assign blame, but to strengthen practice, because the goal in healthcare isn't perfection. The goal is continuous improvement. And here's the truth: every experienced clinician eventually learns. One difficult outcome, even one highly scrutinized, does not define your career. What defines you is what you do next. Do you stay curious? Do you keep learning? Do you continue showing up for patients who need your knowledge and care? Because tomorrow another patient will walk through the door, and they won't need a perfect clinician. They'll need a thoughtful one, a resilient one, a clinician who has faced hard moments and chosen to grow from them. Sometimes the experiences that shake our confidence the most are the ones that shape us into stronger providers. And if we allow those moments to teach us, not silence us, they can make us not only better clinicians, but better healers. Thank you.